Thank you, Stephanie. Good morning, everybody. Welcome. I'd like to call the meeting to order. It is 9:02 a.m. on Thursday, September 18th. Stephanie, would you please take attendance?
Yes, thank you. Good morning, everyone. Ava Bermuda Zimmerman has not joined us yet. Isha Canada will not be joining us today. Adrian Cochran, I don't believe, has joined us yet. Sheila Hummel,
Present, good morning.
good morning. Molly Weston Williamson
Present.
and Justin Zartman.
Present.
Okay, we do not have a quorum.
Thank you, Stephanie. So we will proceed and we will circle back to agenda items that take a quorum if we need to later on. I want to take a minute to acknowledge if we have any members of the public joining us. We're excited to have you and folks who are listening to this later on recording. We're excited for you to be listening to this meeting as well. We're going to skip over item 2 on the agenda because we don't have a quorum to review and approve the minutes for the previous meeting. We'll circle back to that at some point in the future when we do have a quorum. So with that, I'm going to turn it over to Jessica for the outreach and engagement updates.
Thank you, Molly. Good morning, everyone.
We can see your
Alright.
screen, Jess.
Thank you. I was waiting for the confirmation. All right, so starting as I always do, just with a list of events that are coming up. So this is everything we have planned out for in-person events between actually tomorrow and the end of the year. I won't go through them one by one. I'll just give you a moment to kind of skim over the list. But some are events that we've done before and have had, good success at in terms of connecting with a large number of people and the right audience. So some of those that we've decided to participate in again are the CCAR Recovery Walk, the Fresh Checks Day at CCSU and Naugatuck Valley Community College. We did those last year in coordination with the Jordan Porco Foundation, which is a mental health and suicide prevention organization. And it was really great for us to reach those college students and adult students who work and had returned to college and just share with them how Connecticut paid leave can be a support for all serious health conditions, but particularly mental health. We'll also be returning to the CBIA Employment Law Conference in Bristol. And the Connecticut Association of School-Based Health Centers Conference. We did that one last year as well. A couple of new ones that we have coming up that we're excited about. Tomorrow we'll be in Waterbury at the Western Connecticut Area Agency on Aging Health Expo. We'll also be at the Grief Awareness and Education Conference in Hartford, where we'll be again talking about Connecticut paid leave as a support for mental health. And another new one I just wanted to highlight, the Connecticut Psychological Association Conference, which will take place at the Yale West campus towards the end of October. So we'll be busy between now and the end of the year. I'm sure there will be other events that pop up that will add, to our list. But rest assured, we are out there and we are seeing people and talking to people as much as we can. I wanted to give a quick update on some of our healthcare outreach. So I talked over the summer about how we were really renewing our focus on reaching out to healthcare providers and folks that work in that healthcare world. One thing that we have started doing, which we've done one presentation so far and have another coming up, we were connected with the Connecticut chapter of the American Association of Pediatrics, and they invited us to do a webinar for their members. So we did one so far. It was really well received. We have another coming up at the end of the month. And then through that connection, we were also introduced to the Family Support Parenting Program at Yale New Haven Hospital. And so we did a webinar for their parent educators yesterday who actually go out and meet with the families in their homes and talk to them about resources and support as they're becoming new parents. So that was another great connection. Some of the new creative that we have in development talks about Connecticut paid leave from a healthcare perspective. So I'm going to share one video with you that is hot off the press. It just came to me last night at about 4 o'clock. But then we also have a mental health clinician who's going to be talking about her perspective as a mental health care provider, and also a business owner who runs a program that works with disabled and special needs individuals doing equine therapy. And so she'll talk about what she's seen as Connecticut paid leave as a support for her patients and their families. So I know I forgot to hit the button to share the audio, so I'm gonna reshare with the sound. Oops, this one. And bear with me, I have a lot of different screens open to be able to share everything properly, I hope.
As a pediatrician, one of my favorite parts of the job is seeing new babies, and it's been so terrific. Since CT paid leave has started, we have parents routinely coming in with this very simple one piece of paper. We sign it, we fill it out, and then that allows them to have paid parental leave, which is such a gift. We have a lot of really tired new parents, new moms, new dads, new partners, and giving them the opportunity to stay home, bond with their baby, support their partner has just been amazing.
So that's our first piece of new creative with that focus on healthcare providers. And I wanted to thank Erin for introducing us to Dr. Schwab. I think she did an excellent job kind of conveying how we all feel about paid leave and how beneficial it can be for new families, new parents. We, in terms of our school outreach, have continued to do a lot of outreach to different groups. We have held 8 webinars so far. We have separated them into kind of 4 different buckets. So public school operators and then non-public elementary and secondary schools. And we've done webinars both for the employers to help them understand their obligations, getting set up, registering, remitting, et cetera. And then for employees to understand sort of the program from a paid leave 101 perspective, how to apply, what reasons the program can be used, et cetera. We do have 3 more of these presentations scheduled over the next week, but we decided to add some additional dates. And so Amber is working on scheduling those for us just due to demand and people who are, really just seeking that information. We've also had one-on-one conversations with some school districts who have reached out requesting those kinds of meetings. We've also done a presentation for American School of the Deaf per their request, where we were able to secure an ASL interpreter. So we're really trying to be very responsive to any school organizations that want a little bit of extra support as this gets underway. We are also doing a digital campaign for awareness, and this is why I did not put my screen back into presentation mode. I want to share this one with you as well.
Do you work at a Connecticut school? Starting October 1st, 2025, certain school employees will be covered by Connecticut Paid Leave. Learn more by visiting ctpaidleave.org.
All right, so that campaign is also underway. Next, because the committee won't be meeting in October, I wanted to give an update on the Family Expo, which will be held on October 18th at the Hartford Public Library's downtown location from 10 to 2. This is the graphic that we're using to promote the event. In terms of the resource fair portion, this is a list of the different exhibitors that will be there. So the room can hold about 20 tables total. So we're very strategic in the organizations that we reached out to and asked to partner with us. We have a number of state agencies, including OTT, OAC, DSS, DPH, Access Health. And then we also have some different nonprofit organizations, as well as some small businesses. We're excited about the activities and attractions. The idea is that this will be something fun for the parents to bring their kids to do. And while the kids are keeping busy, the parents will have a chance to go around and collect resources. So we'll have some craft stations. We have UConn, Hartford Yard Goats, and CT Sun sending their mascots. The Connecticut Science Center will set up an interactive exhibit. We'll have face painting, balloon animals, ice cream, and goodie bags. So we're really excited about this. I wanted to thank the whole O&E team. Everybody's been all hands on deck to help us get all the moving pieces in order. In terms of promotion, for family and kid activity websites, we've placed some ads with Macaroni Kids, Kidtivity.com, KidsOutandAbout.com, and Mommy Poppins. I've also been identifying some other websites where we can put a free, listing on their calendar page. We have a digital campaign that our partners at Miranda Creative are working on for us, and that's what you see at the bottom of the screen here. This is a carousel ad for social media. So this is what that will look like. We also are using some of our print advertising in La Visión and the White Eagle, which are respectively Spanish and Polish language newspapers in the Hartford area. We have some radio commercials on a number of stations, a couple of Spanish language stations in the Hartford and New Britain areas, and then a few targeted stations in Hartford. We also have flyers that we've printed out and are distributing around Hartford, sending to Hartford Public Schools, Hartford Office of Community Engagement. I really wanted to especially thank Virginia because she lives in Hartford. So she has been our feet on the ground, going around to different places and putting flyers on bulletin boards, handing them out, etc. And then I also wanted to thank Sheila for connecting me to the Office of Tourism. They have put a posting on ctvisit.com for us. So if you're inclined to help us share our social media posts to continue to promote this, that would be great and we would appreciate it. So next time we meet, we'll have a post event recap with photos and information about how it went. So now I'd like to just ask Virginia if she could come on camera and give a community education coordinator's update.
Can you hear me now?
Yes.
Yes, thank you. Hi, everyone. So I'm going to be giving an update. We're currently in quarter 3 of the Community Education Coordinators Initiative. So just a recap of some of the data we collected for quarter 2. Currently, the status of all the work plans, we only have 7 activities that were reported not completed or not started. I apologize. Which is down from quarter 1, which they reported 23 activities not started. So I think this is showing in quarter 2 that they're picking up speed in a lot of the work that they're doing. Currently, we have, as of quarter 2, 66 work plan activities in progress and 11 completed. So a lot more activities are now in motion and they're being completed. And then which is up from quarter 1, where there was only 3 activities that were completed. So that just gives like a basic summary of where we're at with the work that's being done halfway through the year. In regards to application assistance, they reported that 130 people received applications assistance in quarter 2. So far for the first 2 quarters, 178 people were helped. This makes up, for demographics, 64% of the 130 people were women, 32% were about men, 2% were non-binary, and 3% were either not identified or preferred not to answer that question. And just to give you an idea of the kinds of, or the industries that a lot of these people are coming from, most of them are coming from work in retail or the trades, with a smattering across the board in all industries, but most of them are coming from retail and trades at almost 30%. The 3 top reasons are medical leave, which is the most, bonding leave, and then caregiver leave. So those are the 3 top reported types of leave that people are applying for. For outreach activities, the CECs attended 189 different kinds of events that they've either attended or they've hosted, including tabling at businesses, hosting or attending workshops and trainings. So the total impressions that they documented at these events were about 4,878 people that they've made contact with. Total attendees at all these events is 16,454. So there's a good spread of outreach and what's the word I'm looking for? I apologize, but when there's a good amount of exposure, that's the word I'm looking for, going on right now with the number of events that are happening. A lot of these are happening at businesses, so they're directly setting up tables at like grocery stores or businesses, talking directly with employees and employers, attending the community events that are happening. So it's the summertime, so a lot of these are like the Puerto Rican Festival in Hartford, health expos that are happening, working with partners. They also talked about in their monthly meetings piggybacking on webinars and presentations that are already scheduled for other things, so then they can already have that captured audience to present to, rather than trying to recruit people to attend a separate webinar. A lot of people's time are precious, so the CECs have been trying to be getting very creative to get this information in front of as many people as possible. For outreach materials, almost 10,000 different types of materials have been distributed and posted. So this includes like flyers, postcards, brochures, things that are handed out at events or that are stocked at businesses. Again, a lot of them are going to like doctors' offices, businesses around them, and leaving a lot of these materials for people to just come by and pick up. And during the monthly meetings, a lot of them have noted that some materials are very popular, so they have to go back and restock a lot of the materials that they've shared, which is good. So it means people are picking up this information, especially at doctors' offices. One organization specifically talked about how the material has been popular at an OBGYN, so a lot of people are picking up the brochures and information on their way out. The majority of social media posts have been with Facebook. So that's been about 34 posts in Q2. I wanted to give an update also about next year's initiative. For the next year, we want to focus more on application assistance and direct provision of Connecticut paid leave information rather than development and distribution of outreach materials. We decided this because we already have a ton of materials that we don't necessarily need more developed. If anything, we still want to share the templates with the CEC so they can add their branding, but they don't necessarily, there's no need for them to develop more information or recreate the wheel in a way. And this was well received with them when we went over this new change. A lot of them said this would be great because it helped them focus more on the actual assistance and outreach portion rather than trying to develop their own materials. But we still share all of the materials that we've created in template form. So for the current cohort of CECs, we're currently working with them on contract renewals. So we provided them with a work plan and budget template for them to complete and submit to us by October 17th. November 1st, we're going to complete the review of the work plans and budgets. And then through November and December, we're going to work with them to do contract negotiations and execution. And then the contract term will be January 1st through December 31st. This is in line with the RFP process that we're currently going with for new applications. So we wanted to keep that in line and be able to review all the proposals together. So next slide, please. Thank you. So this is the information for the current request for proposals. So we posted the new RFP on September 2nd. So I have the web links here for that are directly to the CT source board and our website where we have it posted. September 10th, we held a information session. We had a few organizations attend that. Some of them had some questions. And then we had a set period of time where anyone could submit written questions. So that was September 15th. As of today, we have not received any questions from any organizations. So we're assuming that's a good thing and that the information session that's posted on YouTube is very informative and that the RFP is also has all the information that they need to complete it. So the proposals are due October 16th. So this is a day before the work plans and budgets will be due from our current CECs. If needed, we'll be hosting proposer interviews between October 29th and November 3rd. And then November 14th, we plan on selecting the proposals and announcing that. So then hopefully by November 17th, we can start negotiation contracts with the new CECs and then start the contract term January 1st, which will end at the end of the year. Another update to next year that we decided based on our experience from this past year is to condense the CEC trainings. So the trainings will be hosted in 1 month instead of 3. If you recall, last time we held the trainings between October and December with an in-person training in January. So this time around, we decided to condense the trainings into 1 month in January, culminating in the in-person training in the last week. So this training will have the same information. The sessions will just be longer. And we'll also host the trainings like we did last year, twice a week for people's schedule flexibility. So if they prefer to attend one day over another. For the CECs of the 2025 cohort, we're requiring new staff to attend the training. So if they did not attend the trainings last year due to they were unable to, or there are new hires, we're requiring that they attend this new training. But we will keep the training open to everyone if there are people interested in having a refresher. And we would like people to attend the in-person training so then they have the most updated information. For our review process, we'll be focusing on specifically the gaps in our program. So identifying the service areas, specifically towns that the CECs will be conducting outreach in, and those populations that they're targeting. So the work plan template that we're providing for them this time around requires that they identify the towns and the populations that they'll be conducting the activities for. And then we'll compare those that information to our claim submission data to identify any gaps or areas where we need more coverage with our CECs. This will help us also be more efficient at identifying organizations we would like to work with, so we don't have 8 organizations in Hartford and like 1 or 2 that are outside in different corners of Connecticut. So we want to be more efficient in how we are setting up this program. We'll also be looking at the quality of the proposed work plans and the experience and current work that organizations indicate in their proposals and the proposed budget costs. So we'll be identifying those like 4 or 5 aspects when we're looking at the proposals in detail when we receive them. And that's the end of my presentation. So if anyone has any questions, I know that it's very high level, but if you have any questions or if you're curious about any of the processes, please let me know.
I see Justin off mute to kick us off.
Yeah, I was gonna follow up on the proposed budget. Is the budget the same as last year? Has that budget changed at all?
So the budget that we have for the RFP is lower this round from, I believe, I forget what last year's total budget was, but this year's total budget is $365,000. So we're looking for about, I would say, 5 to 7 organizations at most. So that pot would be split amongst, well, it wouldn't be split, but we're thinking possibly like 50 to 70, maybe 80 at the higher range per proposal. But it just depends on the amount of work that they're proposing and what their budgets entail.
Just to add to that, when the board approved the CEC initiative, they approved it. We were expecting 12 to 15 organizations, and in that pilot year, we only had 7. So we're still actually operating under that original approval. And then in the annual budget that was approved by the board this past spring, we included money for 2026, knowing that we would be, as Virginia said, looking to expand beyond the original 7. So we're still kind of operating at kind of within that original pot.
Okay, thanks.
Yeah. I should say I was on a call yesterday where an advocate in another state brought up unprompted this program in Connecticut as something that like they were hoping to emulate and trying to run. So I was like, I can convey that tomorrow.
Yay.
The folks who are working on that. I think this is all great. And also we should not skip over how awesome the Family Expo is. And I'm sure it was a truly tremendous amount of work to put that together, and the work is not done yet. As we head into October, I think that's really, really exciting. And I know that's a long, long time in the making, and we won't meet again before that happens. I would ask, I think this is probably a Virginia question. So I think last time we talked, we had the Q1 update on CECI. It was still pretty new. There hadn't been that many months of folks doing stuff. And so we wanted to withhold evaluating what those numbers look like until we had more time for folks to do stuff. In terms of sort of what we're looking at now that we have the Q2 numbers in, like, are those numbers of folks directly impacted? Is that about what we're targeting? Are we hoping to see more in the future? Like, how should we be thinking about that, those numbers of the like 10,000-ish total context? It was, I think, under 200 direct assistance. Like, is that where we're hoping to be longer term? Are we still getting started? Like, how should we be evaluating those numbers?
I think that I mean, it's hard to say overall because each organization is different from the other, but I will say that I'm happy with the increase that we've seen from quarter 1. Definitely, it's hard to measure success within a 1-year time period, which can be very short, but I do think that they've been making a lot of progress with the work that they're doing, and especially looking at the work plan activities themselves and the
Oh, we lost her. She
Lost
froze.
her. But I think we're also still looking for growth, and that's part of, particularly with regard to the direct assistance, and that's really part of why we are focusing on direct assistance with the renewals and with the expansion.
I'd like to share too that yesterday when I was presenting to that the parent educators from Yale, they specifically asked, well, what happens if we are working with parents who don't have a computer or they don't really feel comfortable? And so when I talked about how we have these different groups throughout Connecticut that specifically have set office hours or, appointment setting where folks can go in and sit down, not only have access to that, computer, but also someone to sit with them and explain everything. They were like blown away. They were like, that's amazing. We're so glad that that's something that you offer. So I think too, we'll continue to see growth the more we are able to share with our different partners that the CECs are a resource. So it's not only the work they're doing, but also the work that we're doing internally to continue to make them more known, right, to the folks who are connecting with our stakeholders.
That's helpful. Other thoughts or questions on any of what we just heard? Okay. Hearing none, is there any old business anyone would like to raise?
Molly, I think, I'm sorry, I think it might have been underneath the agenda of my updates, but I know Nancy has
Oh,
a
yes.
past update to present.
Well, then we will take that as our next order of business. Nancy, take it away.
Thank you. I'm going to share my screen. And just let me know if you can see. I'm going to see if I can get into present mode. There we go. Can you see my screen?
Yes, we can.
Okay. Well, it's good to see everybody. I missed everybody in July, so I feel like I haven't seen you all. So it's really good to see you. And with the podcast, we are going over September and October. We're going over the guests and the topics, a little bit of Buzzsprout stats, not too many, and a little bit of some continued outreach. So far, we have 8,435 downloads and 87 episodes. Going into September, in the corner is Evelyn Alejandro. She was the guest for Hispanic Heritage Month, which runs from September 15th through October 15th. And she is the executive director of Pivot, which is the Professional Young Visionaries of Tomorrow with the Central Connecticut Chambers of Commerce. And she's also the owner of a marketing firm called Agape Designs. I kind of found her through Mental Health Connecticut. There was a really great article about her, and she talked very honestly and openly about both of her parents who suffered from mental health issues. Her father was schizophrenic and her mother was bipolar, and both have died. And she was very young. Her mother died in a car accident when she was 14. So Evelyn also had to struggle very young with some really traumatic things. And it was a really interesting podcast talking to her. She's very young, and it is very evident that she was suffering from PTSD. So we had a nice conversation about it, and I learned a little bit more about Mental Health Connecticut, which is a really good resource for people. The second podcast that will be uploaded later this month is National Sickle Cell Awareness Month. And my guest was Dr. Janice Nelson. She's the nursing director at UConn Health at the New England Sickle Cell Institute. I didn't know there was one, so I got educated myself. And they have our information in their lobby in English and Spanish for all the patients to see, which I thought was really fantastic. She was very knowledgeable about the program, and saw the importance of the program for caregivers and for patients themselves who go and may have an exacerbation of their sickle cell and need to be hospitalized or need to get different types of treatments. The second guest was Daisha Dillon. She's a sickle cell patient. She was diagnosed at birth, but she had a very healthy baby girl without sickle cell. And she used Connecticut paid leave when she had her baby. And I think she went in at 36 weeks, if I'm not mistaken. And so it was very easy for her to use. She talked about that. And it was really wonderful to see this program with sickle cell being out front and center, with UConn Health at the Sickle Cell Institute, and with Daisha, who used the program. And she can use it again now if she needs to, because she does have exacerbations of sickle cell. So she does go to UConn and get treatment. In October, it will be National Osteoporosis Day, October 20th. My guest, and I'm recording next week with both of these people for both October guests. Joan Dobach is the bone health coordinator at the Connecticut Orthopedic Institute. That's at St. Vincent's Medical Center in Bridgeport. We talked yesterday about the podcast and what our focus would be, and how we see this working. And so we discussed osteopenia, which is sort of the precursor of osteoporosis. And she wanted to talk a little bit about the criteria for fall prevention for mainly women over 50 who can have fractures if they have gone through early menopause or and so it was really interesting that she really wanted to talk about that. And we'll talk about treatments and how caregiver leave would be really helpful for the families of older osteoporosis patients. We had a long conversation about that. And she was not very knowledgeable about Connecticut paid leave. So that was really exciting that I reached a healthcare provider that didn't really know. And so I told her that we would be more than happy to do a webinar with them. So she was very receptive to that as well. And the other podcast that I will do in October is a study. Drexel University had them making the case for paid family leave. And the guest is Natalie Schacht. She is the researcher. She's the Associate Director of Communications and Administration for the Center of Hunger-Free Communities, Dorrance Life School of Public Health, of course, at Drexel in Philly. And the discussion will be about the benefits of paid leave for family, physical, mental, and financial well-being, and the focus of the impact of paid family leave on businesses and communities. It's a really comprehensive study, and it's really exciting that she offered to be on the Paid Leave podcast. I'm really excited to have her and to discuss the research that she found. And a little bit of Buzzsprout stats here. The last 7 days we had 52. Last 30 days we had 198 downloads. The last 90 days 757. And we are, I checked this morning, sorry, we're at 8435 today. I did this slide yesterday, so we had 5 more downloads. So that was good to see. Buzzsprout has a lot of really cool information about the cities that listen, the countries that listen. I love looking at Buzzsprout and looking at the statistics that they have out there. It's fun to watch that. And you can find the Paid Leave podcast on our Connecticut Paid Leave website, our YouTube page, and all the platforms that you find podcasts like Apple or Spotify, Google. Some people like Overcast. But please like and subscribe. And the way we really grow this is pretty organically. So if you find one of the podcasts, one of the 87 that I've done, and it resonates with you and you think that it might serve some of the people that you know, I would really encourage you to share those podcasts with them. And if there's any questions about the podcasts, and if you have any ideas or you've come across any articles that you think might be great for the podcast, I am certainly open. And I'd love to hear from you. Justin, you gave me some really good, you gave me really good guests. So I appreciate the help with that.
Thanks, Nancy. Any questions for Nancy? Okay. I want to pause for a moment because I believe we've had another member of the board join us. Ava Bermuda Zimmerman, are you with us?
I am.
Thank
do whatever
you.
you have to do.
And I'm sorry that I logged in with the wrong account.
No, I appreciate the
No worries, we got you. Stephanie, I believe that means we now have a quorum. Is that correct?
That is correct, yes.
Thank you. So with that, I'm going to circle us back in the agenda to the review and approval of the July meeting minutes, which we skipped over earlier since we didn't have a quorum. I'd like to ask the committee for a review of the July 17th, 2025 minutes and a call to approve. Is there a motion?
So moved.
So move. Oh, second.
I hear a motion in a second. Is there any discussion about the approving the July minutes? Okay. All in favor of approving the July 17th, 2025 minutes, please say aye. Aye.
Aye.
Any opposed? Any abstentions? Okay. The motion carries and the July minutes are approved. Thank you so much, everybody. So with that, we're going to hop back down to number 5 in our agenda. Is there any old business anyone would like to raise? Is there any new business anyone would like to raise? Okay. In that case, may I have a motion to adjourn?
So move.
Thank you, Ava. Do we have a second?
Second it.
Thank you, Sheila. Any discussion of the motion to adjourn? All in favor of the motion to adjourn, please say aye. Aye.
Aye.
Aye.
I'm counting that as the ayes have it. That's 4 ayes of everyone on the board. The motion carries. It is 9:40 a.m. and this meeting of the Outreach and Engagement Committee is adjourned. Thank you so much, everybody, and we will see you in 2 months.
Thank
care,
you,
everyone.
everyone.
Thank you.